In this lecture, we are going to discuss acetylcholine from both aspects, endogenous and the exogenous. And we will also see the effects of the acetylcholine on the different parts of the body. Basically, acetylcholine has both aspects. Endogenous, it naturally produces in our body, and exogenous, it can be given through outside in the form of Miochol-E. It's the brand name of the acetylcholine. First of all, we will see the receptors of the acetylcholine and the neurons of the acetylcholine. Basically, our nervous system has categorized into two, that is CNS, central nervous system, and the PNS, peripheral nervous system. And the peripheral nervous system is further categorized into the somatic nervous system and the autonomic nervous system. And autonomic nervous system further categorized into the sympathetic nervous system and the parasympathetic nervous system. So this is the division of the nervous system. So first of all, if we look at the sympathetic nervous system, so in the sympathetic nervous system and in the parasympathetic nervous system, two main neurons present, preganglionic and the postganglionic. In this sympathetic nervous system, first case is the preganglionic neurons. It produces the acetylcholine. It's a natural process. It naturally produces in our body. Then this acetylcholine bind with its receptor. Acetylcholine has two receptors, nicotinic receptor and the muscarinic receptor. It binds to the nicotinic receptor that is present on the adrenal gland above the kidney, and after that you will see the productions of the epinephrine and the norepinephrine that will bind to its respective receptor. That receptor is adrenergic receptor for epinephrine and the norepinephrine. Second case is the preganglionic and the postganglionic. Preganglionic neuron also produce the acetylcholine, which binds to the nicotinic receptor on the postganglionic neuron. After that, this postganglionic neuron also produce the another thing, that is the norepinephrine. Now this norepinephrine bind to the adrenergic receptor that is present on the effector organs. So this is the pathway of the sympathetic nervous system. This is the two most common cases in the sympathetic nervous system. Next is the parasympathetic nervous system. Again, in the preganglionic will produce the acetylcholine that's bind to the receptors on the postganglionic neuron. In that case, you will also see the nicotinic receptor. After that, acetylcholine produced by the postganglionic neuron or fiber will bind to receptor, that is muscarinic receptor. Acetylcholine can bind to two, nicotinic and the muscarinic receptor, while the norepinephrine bind to the adrenergic only. Okay, so this is the pre and this is the post. And second is the somatic nervous system that has only one neuron. This neuron produce the acetylcholine, and now this acetylcholine will bind to the nicotinic receptor. These are mostly present on the muscles. So this make the neuromuscular junction. So this acetylcholine will bind to the nicotinic receptors that are actually present on the effector sites. So if we summarize, nicotinic receptors present on the adrenal gland in mostly post-ganglionic neurons. Here is the receptor on the postganglionic neuron. These are the nicotinic in nature. And last is the receptors on the nicotinic receptors on the effector organ in case of somatic nervous system. But muscarinic receptor is only present in case of parasympathetic nervous system, and that is the present on the effector organs. So this is the parasympathetic. So if we look generally, that the parasympathetic nervous system has two nicotinic and muscarinic receptors, and acetylcholine mainly affects on these receptor, nicotinic and the muscarinic receptor. So this is the diffuse effects of the acetylcholine. Acetylcholine produces the diffuse effects because it has major receptors on the different neurons and the effector organs. So acetylcholine naturally produced in our body. It can also be given through the exogenously, and its brand name is Miochol-E. That is the brand name of the Miochol-E. So the structure of the acetylcholine, this one, and this is the choline esters, and it has a positive charge on it. This is the main features of the acetylcholine. Now we will see how acetylcholine produces its effects on the different organs. First one is the heart. So as we see that there are two main receptors on which acetylcholine produces its effect. First one is the muscarinic receptor and second one is the nicotinic receptor. There are a lot of muscarinic receptor, and muscarinic receptor mostly present on the effector organs, like muscarinic receptor present in the heart, in the blood vessels, in the GI tract, in the lungs, in the urinary bladder, in the eye. So this is the effector organs. And nicotinic receptors mostly present on the muscles and the post ganglionic neurons or fibers. So mainly you have to remember muscarinic receptor mean it's present on the different organs, and lot of different types: M1, M2, M3 and M4 and M5. These are the different types of the muscarinic receptor. So in the heart you will see the presence of the muscarinic receptor. Naturally, when acetylcholine produces in our body, it acts on the muscarinic receptor that is present in our heart and reduces the heart rate, because sympathetic nervous system activates in fight and flight. In the sympathetic nervous system, our heart rate increases, but parasympathetic nervous system regulate or normalize the heart rate to its normal level by reducing the effect of the sympathetic nervous system. But acetylcholine naturally produced in our body. If we give the acetylcholine through the exogenous route, then ultimately it will bind to the muscarinic receptors on the heart, and ultimately you will see the decrease in heart rate, that is bradycardia, decrease in heart rate, and ultimately you will see the reduce in the cardiac output. So this is the first effect of the acetylcholine. Okay, that will be similar to the effects produced in the parasympathetic nervous system activation. Next, you will see the presence of the blood vessels, and here is the endothelial cells, and after that you will see the presence of the muscle. So endothelial cells has also muscarinic receptor, that is specifically M3 muscarinic receptor. Now, when we give the acetylcholine through the IV line, then this acetylcholine binds to the M3 on the endothelial cells. Ultimately, after binding, you will see the productions of the nitric oxide, NO, nitric oxide. Now this nitric oxide diffuses into the smooth muscles of the blood vessels and activates or produce the protein kinase G. Now this protein kinase G hyperpolarize the smooth muscles, and ultimately you will see the relaxation of the smooth muscles present in the blood vessels. After the relaxation of the smooth muscles, you will see the vasodilation, and vasodilation, due to the vasodilation, ultimately the blood pressure starts reducing. So this is the effect of the acetylcholine: decrease in the heart rate, decrease in the blood pressure. Next, GIT tract, gastrointestinal tract. So also GIT has muscarinic receptors and it increases the secretions of the GIT tract. It increases the secretion. What type of secretion it will increase? First one, it will enhance the secretion of saliva. First one. It will also increase the secretion of gastric secretion and also the intestinal secretion. So these secretion will be enhanced due to this one, acetylcholine. Saliva secretion, gastric secretion and intestinal secretion. Along with that, you will see the increase in the motility of the gastrointestinal tract. That is the important thing. And the adverse effect related will be GIT tract, because due to the high motility, diarrhea can be seen as adverse effects of the acetylcholine. Next is the respiratory tract. It will also increase the secretion of the respiratory tract. Again, it will increase the secretion of the mucus secretion in the trachea and the bronchi. And important thing, it causes the constriction of the bronchi and the trachea. That is the bronchoconstriction effect produced by the acetylcholine. Naturally produced in our body, but it will only use as a regulatory. But if we give it through the outside, then it will produce this type of effect, that is bronchoconstriction. An important cholinergic agonist will be methacholine. Methacholine, and its brand name is provocholine. Provocholine is used as a diagnostic tool for asthmatic patient because it causes the bronchoconstriction. So it's a good diagnostic tool for the asthmatic patient. So that is the important thing. But you have to keep it in check by using the methacholine. Next is the urinary bladder. Urinary bladder has a muscles, that is detrusor muscles. Urinary bladder is made by the detrusor muscles. Acetylcholine enhances the tone of the detrusor muscles. When you will see the increase in the tone of the urinary bladder, then the ultimately urine that is present in the urinary bladder starts secreting outside the body. That is the urination process. So by the increase in the tone of the detrusor muscles, that is the important thing. Next is the effects on the eye. So as we know that the eye has a ciliary muscles through which the lens is attached by the different filaments. So it increases the constriction of the ciliary muscles for near vision. For the near vision, it causes the constriction of the ciliary muscles, and ultimately you will see the accommodations in the eye. Next, most important, the black part of our eye, that is caused by the different colors in the eye, that is produced by the iris. So iris has two major components for two major muscles. First one is the radial muscles, or you can say dilator pupillae. Radial muscles or dilator pupillae. Next, inside you will see circular muscles, or you can say sphincter pupillae. This is the two type of the iris muscles, radial and the circular. And at the center you will see the presence of the pupil. Around you will see the presence of the iris muscle, and at the center opening will be the pupil. So acetylcholine produces its effects on the sphincters pupillae or the circular muscles, and ultimately due to the contraction of these muscles, you will see the size of the pupil start reducing, and this process is called the meiotic effect. That is the uh, decrease in the size of the pupil, and that effect is called the meiotic effect, and it is mostly used in the eye surgery. So drops are actually present, and we use it before the eye surgery. So that is the important effect of the pupil, that is meiotic, in which the reduction in the size of the pupil. So this is all about the acetylcholine, which is a cholinergic drugs. So if you still have any question, you may ask in the comment section. Thank you so much.